Hi, good evening and welcome all of you. Welcome Dr. Sumeet and welcome to everybody on our third edition of the India Health Talk. And thank you very much for all your comments and feedback on our last topic. So Sumeet, you remember we talked about Arogya Setu and the privacy concerns around it. We had differing opinions. You took a different stand, I had a different stand. And what we are happy to tell you is probably because one of the reasons we had the talk and one of the effects of the talk is now the government has opened at least the Android source code for independent parties to review it. So Sumit, I think we are making a difference. I don't know how much credit we can take, but definitely it was, we got a lot of feedback from a lot of eminent healthcare thinkers and technologists on it. So this edition, we want to talk about another aspect of COVID, moving away from privacy, moving away from contact tracing to the state of our mental health, which is obviously highlighted by the number of days we've stayed in lockdown now. So Dr. Sumeet, any perspectives on what's wrong with us or what's going to be wrong with us once we come out in the public?
Sure, Dr. Vikram, and good evening. And I think the last topic on which we discussed about privacy was quite controversial, but very relevant as well.
Correct.
And so is mental health. It's very relevant, very pertinent to our daily lives, but somehow I feel that it's neglected. So let me begin by sharing with you some staggering stats. Okay, and this stat that I'm telling you is pre-COVID.
Okay.
So according to the Global Burden of Disease study, 1 in 7 Indians, okay, or around 200 million Indians are affected by mental disorders, okay, and their contribution to the overall disease burden has almost doubled from 2.5 to 4.8% over the last 15 years. And this is pre-COVID, okay. Now, keeping that in mind, there's a study which WHO conducted, okay, and just before the outbreak of COVID, like when it was, increasing its spread in different countries, it predicted that by 2020, around 20% of India will suffer from mental illness, okay, which is a number. And this topic is not discussed much in the media or by our experts or in different forums that you and me read or view on daily basis. Okay, and by this rate, we can expect that this go up during and post the crisis. Okay, and recently another survey was conducted by the Indian Psychiatric Society, which was, I think, in the second or third week of the first lockdown phase 1. And it said that the number of reported cases of mental illness in India has already risen by 25%. Okay, so right at the start, the impact of the negative impact of this pandemic on our mental health has been of paramount importance. Okay, but what do you think mental health and wellness is neglected here? We never talk about it, not much. Okay, as much as it is needed to be talked about. So what do you think would be the reasons?
Yeah, I think that's an excellent question. So I kind of agree with your stats, right? So I worked on a paper with a very large technology firm, actually Intel, and I was on a paper where I, contributed to that paper. And one of the things that they wrote about was this fact that about 20% of Indians would require some kind of mental wellness sessions by 2020. I suspect the real stat would be around 100% right now, given the situation we are in. So I think historically, we've existed for 5,000 years or thereabouts. And I think historically, the source of our mental strength used to come from spirituality and religion. I think that was the major source of mental health. I think even Sushruta and Charaka write about mental health in their text, and they talk about the ways to deal with it. So it's not like it's a new concept to India, but as we have changed from our traditional practices to more modern medicine, somehow the taboo around mental health is very high, right? And it goes back to, I believe, and this is just my belief, it's not that it's documented anywhere and I'm not done research on it. It more or less it goes back to our fatalistic attitude towards things. If I'm sick, it's because I'm meant to be sick, or this is how things are. So and in middle of all this, understanding the state of mind and whether you need therapy is totally neglected. I think it's one of those hidden scenarios in India, and there's an immense pressure. Right from, if you remember how we used to study in 11th and 12th and even before that, there's immense pressure right from board exams of 10th standard, from then on. And none of us ever go to counseling. I've never seen a counselor, right? So it's more like a habit and a taboo and lack of awareness more than anything else, than anything I can think of. And that's just my opinion. It's not that I've read anywhere what are the real reasons. But what do you think are the reasons, in your opinion?
Sure. See, traditionally, I think traditionally Indians are known to have a better stress resilience than in the West. But however, it has been observed that the readiness to seek psychological help is higher in West as compared to India. Okay. And taboo is something which I feel should be on the top of my list in terms of the reasons. We need to be more open. It should be included in our education system right at the start, that mental health and wellness is an integral part of our overall health. Okay. Now, if we shift more towards this pandemic, which has highlighted this issue. Okay. Couple of examples here in India, itself. Like I was reading a few days back that a 35-year-old man was placed under some home quarantine in Tamil Nadu after return from Sri Lanka, and he ran out of his house naked, and he just bit his 18-year-old woman on the neck, and she died in the hospital. Okay, and so he was under quarantine. So they are assuming that there was some mental pressure created on him, which led to this this step from him. And another one, like there was a patient quarantined in Delhi itself, in one of the biggest hospital, the Safdarjung Hospital, and he jumped off the 7th floor and committed suicide.
Wow.
Okay. So there are cases, and globally as well. So a high-profile case, if you come to a non-common person in Germany, there's a state by the name of Hesse, and the finance minister of that state committed suicide, and the reason cited was that he was deeply worried over how to cope with the economic fallout from the crisis. So you see these cases often. And I think steps should be taken and are being taken by some of the governments and even the organizations with which people work. Okay, there are technological advancements which can help people cope up with such issues. But I do feel that in coming months, a massive mental health crisis awaits India and other countries due to unemployment, alcohol abuse, economic hardship, domestic violence, and the debt that we all might fall into.
Yeah, I will just say something here, right? You brought up an excellent point. So I stand corrected. Sorry, I want to give full disclosure here. I've been to a counselor once, and this was after my mom's death. When my mother passed away, I really had to talk to somebody outside my family, and I did seek help that time. But apart from that, I haven't, and I've been through very stressful times even during my undergraduate days in medicine and my postgraduate days while doing my management education, and obviously the work we do. But I've never sought any help outside. The interesting point you bring up is de-addiction, right? It's a spectacular point which is often neglected. So incidentally, Dr. Sumeet, today is World No Tobacco Day. And always say, hey, quit smoking, quit smoking, quit smoking. But smoking is an addiction. I don't know if you realized there are more than 7,000 chemical ingredients that go into making these products, and almost 200 of them are harmful, 69 of them are carcinogenic, and a lot of them are addictive. They are addictive, and because they are addictive, you need some kind of a therapy to get out of it. But because our mental health infrastructure is so poor, our understanding of who needs mental health, who doesn't, is so poor, that we just ban public smoking and make sure that there's a heavy tax on it, and that will act as a deterrent. It doesn't. It doesn't work. That's one example. Another example is all the students in India. I think our education system really taxes a lot out of them, and giving them very little hope to cope with it. So I think there's a huge demand for it. but there is very little recognition that even things like to stop smoking or to deal with your 10th standard board exams might require some degree of mental health counseling. So that's an important point.
Great. Another thing I want to add to what you said, Dr. Vikram, is the concept of self-care. Okay, when I talk to a lot of people in my peer group or in my office, we think that mental health is our responsibility. I agree with that. I totally concur with that. But I also feel that it's a responsibility of the employer whom we work with, the government, and there has to be sufficient mental health infrastructure. Adopting policies at the employer level, I think will take it to the next level. Then the mental health and wellness of entire population would improve, and they will be more aware of it. Okay, we have seen few celebrities talked about in the open, but hardly anybody comes out and talk about the issues related to mental health. And now the steps are being taken in the right directions, maybe because of the pandemic. But I have seen organizations, they are working with government agencies to focus on person-centered cares. They see they collect a lot of meaningful data from the stakeholders, which includes like determining the food safety and emergency assistance needs, directing them to community care providers. So all these aspects should be covered, and there should be a proper plan associated with each within each country, so that things can move forward in providing mental health.
Yeah, I agree with you. I just hope that I think the pandemic might act like a trigger, but let's hope that this is the direction we're going to take. Anyway, I have seen the national mental health policy. Obviously there are elements of which are very useful, and I think the government has kind of provided some degree of standards, but a lot more work needs to be done. And
Absolutely.
and let's not forget, we don't have enough professionals to do this. This is a highly specialized job, where counseling somebody is not going to be easy. It requires a lot of training, lots of coaching. So already we don't have people for that. But the only silver lining I see in the whole thing is now with the telemedicine becoming guidelines available with NCI. I think we will see a lot more counseling happening. As long as nobody sees me going to a counselor or a psychiatrist, I feel happy.
Yeah,
So,
and there are few startups also in this field, okay,
Mm.
where you can consult a psychiatrist anonymously by a chat function or maybe over a call. So there are a few startups that have come up in the last 2 or 3 years. Okay, and only thing that I can urge our viewers is that as we try to keep ourselves and our families safe and cope up with the stress of physical isolation and disrupted routines, I think we should come out with our problems that we face, the hardships that we are facing, and talk to experts, talk to our employers, and things can be sorted out. So we should come out, make people more aware, so that appropriate help can be sought.
yeah, nothing like it, nothing like it. So seek help if you want. There are quite a few platforms out there. I saw Dr. Ashwin Naik also has started his platform, and there are quite a few. So anytime you need help, please do seek help. Don't tackle this alone. It can get really out of hand. And COVID or no COVID, all these problems are temporary. You are permanent. You have a longer lifespan. So let's hope that things get better. And what we also like, Dr. Sumeet, is to get some views, right? Like we did in the previous two. Let's get some views on how to tackle this problem. I think this is an
Sure.
immense problem that we are seeing, and let's hope that we get some suggestions from our viewers as well. So as always,
Absolutely.
pleasure chatting with you. Have a great rest of the evening and enjoy the rest of your Sunday.
Sure. Thank you, Dr. Vikram. Have a
All
great
right.
day.
Bye.